Hi, I just want to start by introducing myself. I'm Sue Boyer, the nurse practitioner with CareATC. Justin, he's our physical therapist, and then we have Kelly, our resident dietitian and health coach. And we're here today having a roundtable discussion about COVID-19. We all hear a lot of questions being asked every day by our patients regarding COVID-19, how their health plays a role in their risk factors, and we thought that doing a video might help address common questions that a lot of you probably have out there. But before we get started and really dive into the comorbidities and how they affect COVID-19, I just really wanted to stick to the basics and remind everybody how important prevention of COVID-19 is. Let's all talk about how do we prevent from getting it in the first place. We know absolutely 100% masks work. We should be wearing them at all times. Social distancing ourselves, maintaining those 6 feet, washing our hands frequently, avoid touching our faces, and most importantly now, getting that vaccine as soon as you're able to get that. It's important that we all get vaccinated. So I think we'll open up with probably the most common issue that I'm seeing related to COVID-19, and that's anxiety itself. So many of us are so anxious right now during this time of COVID, and it's understandable. There's a whole change in our routine. Life as we know it has changed. There are financial responsibilities that we all have that are, always in question. Of course, we're all worried about COVID-19, getting it, having loved ones get it. How are we going to do if we do get it? What are we going to do? So I just want to talk about how we can help ourselves with anxiety and the things that we can do that will improve our own anxiety levels and help us through this challenging time. So Justin, how do you handle anxiety with your patients?
Hey, thanks. Good to be here with both of you, and great introduction. And wow, this has been a tough road over the last few months for sure, and has increased anxiety levels and stress levels. So I'm glad that we could be an encouragement in that there are things you can do, as you said, to prevent and be proactive and manage. And then just encourage folks that we are here and are resources for them during this time and whenever needed. So you'll hear a lot of good information today, and most of it will be superscripts of the same answer, which Susan began to say. Listen, be vigilant about your self-care and safety, diet and exercise. So exercise is a great means whereby you can improve your well-being and decrease your anxiety. And maybe a tangible tip, Susan, is that breathing is an exercise. So just being mindful about your breathing. The American Institute of Stress suggests that just focusing on that 20 minutes a day could have significant impacts on decreasing anxiety and improving well-being. And that could be as simple as putting a hand on your stomach and a hand on your chest and just connect with the rhythmic nature of the breath. Inhale for 2 seconds, exhale for 4 seconds, and just focus in on that. So again, a great starting point just to maybe ease anxiety and to refocus. You can focus on when you inhale and exhale that you're really trying to inflate all aspects of the thorax. So 360-degree breathing is a great cue just to expand all compartments and increase efficiency of breathing and oxygenation. And in that, again, you'll get some very positive effects on stress levels. A couple of apps, the My.Life app, my.life, and the Calm app are two that I find that really help you in mindfulness and scheduling these times. So just a quick tip, maybe just focus on breathing, view that as an exercise, great way to begin to produce some calmness and decrease anxiety.
And I'll add to that, I also really like the Headspace app that you can get on your phone. And again, speaking to your deep breathing, they go into how to do those deep breathing exercises. There are bedtime stories that you can listen to. Bedtime is a particularly difficult time for people. It's when you're finally quiet down at the end of the day and all those thoughts come flooding at you, it's often hard to turn off your mind for a little bit, just enough to relax, and that can be very helpful, tuning into one of those stories to calm your mind. And on your comment about exercise, is I always like to remind people, we all have natural feel-good neurotransmitters in our body available to us. We just have to turn them on. And the way to turn them on is through exercise. And it doesn't have to be a formal exercise routine. It doesn't have to be that you go to the gym or anything like that. It's putting on a pair of sneakers and going for a walk. Getting outside every day in nature is a very effective way too at increasing your feelings of well-being. Kelly, do you have anything to add to the anxiety piece?
Well, when it comes to anxiety and nutrition, there's not necessarily one or two particular foods that can help you to remain calm. In addition to activity and just being mindful of everything that's in your environment and what you're working with, I would just recommend making sure you're eating 3 balanced meals every day, making sure you're including lean proteins, plenty of plant-based foods like whole grains, fruits, and vegetables, and ensuring that you're getting your healthy fats too. And that can really help you to get all of the nutrients that your body needs to really just do its job well.
All right, so the next question we're going to get into really starts getting into comorbidities and how they directly affect reality with COVID. So if you get COVID, we know that having certain underlying health conditions really do affect your outcome. And the number one question, concern is regarding diabetes and how that affects your outcomes. So I do want to talk about diabetes. What can we do to help control our diabetes, to reduce our risk of complications if we should happen to come down with COVID? And I think I'll just start here by saying it's really important, if you do have diabetes, that you make sure that your diabetes is well controlled. So when is the last time you had an appointment with your primary care provider, or one of us, a provider at CareATC, if we're a provider, making sure that you are seen every 3 to 6 months, depending on what regimen you're on. Is your A1C well controlled? And making sure that we know that. So coming down with any illness, whether it's COVID or the flu for that matter, it's good to have good control of your diabetes. So I'll head your way now with that.
So like Susan said, the best thing you can do is make sure that your blood sugars are under control, because when they're not under control, they can really affect the body's ability to stay well and to heal itself or recover from illness. So controlling your blood sugars is going to be very important, and to do so, you want to start off by, again, making sure you're consuming your lean proteins, plenty of vegetables, but also controlling your overall carbohydrate intake. Carbohydrates affect our blood sugars the most, so the amount that we consume and the type we consume can have a huge impact on how our blood sugars are. Carbohydrates are found in starchy vegetables like potatoes, peas, and corn. They're also found in grains like rice and pasta, quinoa, as well as fruits, and then also our sweets and baked goods and things like that. So again, what we want to try to do is make sure we're choosing the higher quality carbohydrates, and those are going to be your fruits and your vegetables and your whole grains. These contain a lot of vitamins and minerals, as well as fiber, and fiber in particular helps to control blood sugars a little bit better. So you want to make sure you're eating plenty of these, but controlling the portion sizes of those at a meal. Another area to focus would be decreasing added sugars. Foods that contain a lot of added sugar tend to have a lot of calories, empty calories, and no nutritional value, and they tend to cause a lot of fluctuation in our blood sugar. So working on decreasing those can really help to improve your blood sugars as well.
Yeah, I think maintaining a normal weight for your height as well is very important to the control of your diabetes. So in addition to the changes you need to make because you're diabetic, of course, always making sure you're always working on trying to lose any additional weight if you are overweight. And we know that exercise helps with that.
Right on. So many benefits, right? So generally promotes a metabolic homeostasis, and then specifically with the diabetes, exercise will decrease blood sugars and decrease insulin resistance, decrease adipose tissue, decrease A1C. So largely think about, again, movement as exercise. So I like what you said. You start with movement. Movement matters. We're all unique movers. And you can think of moderate intensity exercise as if you were walking with somebody and you might have, you have the ability to maintain a conversation, but it might be difficult for you to sing a song. That would be moderate exercise. So rate of perceived exertion is one benchmark you could use. 0 would be there's no effort in what you're doing at all, and 10 would be it's the most difficult thing you ever did. You would like to be in the 3 to 4 out of 10 range to be in the moderate exercise range. 65 to 75% of heart rate max is another little metric you could use to identify if you're in that moderate exercise zone. So taking the number 220 and subtract your age, that could generally be considered your max heart rate, and then take 65 to 75% of that and try to function at that level for some degree of time. Again, any questions on a starting point, or if you have other comorbidities where more aggressive exercise might be questionable, then please get with CareATC or to just get the okay to do that. But celebrate starting somewhere when it comes to movement or exercise, and gradually build up your tolerances as your body adapts. And again, we can serve as touch points for contact when it comes to how and when you should increase intensity of exercise. The American College of Sports Medicine suggests that a good target is to work up to 150 to 300 minutes of exercise over the course of the week. So getting 30 minutes of moderate exercise most days of the week will be very effective in decreasing many of these markers that are associated with the comorbidities we're talking about today. Again, another tangible tip, trying to shoot for 1,000 steps in 10 minutes, or a pace of 100 steps per minute, typically will be in the moderate exercise range. So again, encourage you to reach out to us as a resource as a starting point. But even what was stated prior, where you are today likely isn't where you were 8 to 10 months ago for a variety of reasons, including COVID-19. So maybe your fitness level 10 or 12 months ago is much different than now. So if you're unsure if you should start at the same place or where to start, I would encourage you to get a hold of us.
And just one more thing I'll add about the diabetes, also knowing what, in addition to your A1C, making sure that you know what your cholesterol is and your blood pressure. All those are major risk factors for developing heart disease, which of course is another risk factor, comorbidity that we have to deal with when dealing with COVID-19. So they're all very much interrelated. All right, let's see. Question that I received, I oftentimes, I'm overweight and I'm scared about getting COVID-19. What should I do? What can I do? So I think a lot of where we go with that answer to that question, actually we kind of addressed already how important our diet and exercise is. I also tell people I'll have people that are so busy with young kids, young families, working full time. Now you're trying to get your kids through, learning at home, and how do you fit in exercise for yourself? Always remember, it's not an all or nothing phenomena. If you have 10 minutes today, you have 10 minutes today, and that's awesome. Even if it's turning on music, the radio, and jumping up with your kids and dancing like crazy, they'll love it, you'll love it. It gets everybody up. It's a great thing to do when everyone's stressed at home too, because we know kids' levels are stressed. Kids are stressed at learning at home. It's not a good time for anybody right now, so sometimes just getting up there, blasting that music and dancing it out is a great way to kind of change things up and get you moving more than you did yesterday. So just get out there and move a lot will help you just start thinking about a healthier lifestyle. But of course, our diet and exercise play a really important part in obesity.
Yeah, so the best thing that you can do, of course, would be to lose weight and to reach a healthier BMI. And sometimes that's easier said than done. It's not always necessarily about just cutting back on calories, although for some people it could be that simple, just smaller portions and fewer calories. But it really comes down to making sure your body's getting the nutrients that it needs and making sure that you're consuming an adequate amount of calories to get all of those nutrients. So a good place to start would be to consume 3 well-balanced meals every day that include protein, again, plenty of fruits and vegetables, your whole grains, your healthy fats, and minimally processed foods. Again, these foods are going to be high in protein, vitamins, minerals, fiber. All these things can help to contribute to a healthier weight. Another thing you'll want to do is, again, just start limiting processed foods, fried foods, and added sugars, like our baked goods and our sweets and things like that. These types of foods provide very little nutritional value, and they often have an excessive amount of calories, which can lead to weight gain or even just prevent you from seeing that weight loss. So if you follow a couple of these dietary changes, it could potentially help you to see that weight loss and help you to reach a healthier BMI.
Yeah, some great advice, and nothing changes until something moves. So just keep on moving, even if it's small incremental steps. I think that's great advice. Obesity and diabetes are related to chronic inflammation, and we've seen with COVID a relationship with that cytokine storm, which is inflammatory. So again, another great benefit of exercise is its anti-inflammatory function. So just yet another benefit of just trying to find something that you can do consistently and maintain it.
Yeah. I also encourage people to recognize when trying to lose weight, it doesn't have to be an all or none phenomena. Like, you don't have to get down to that ideal BMI or the ideal weight in order to see benefits from that. We know that just losing a 5 to 10% of your weight right now will decrease your blood pressure, decreases your risk for heart disease. It takes a ton of pressure off of your joints. What is the statistic for every pound lost?
So depending on the joint that we're speaking of, for every pound lost, there could be anywhere from 3 to 6 pound decrease on the joint that we're talking about. So a decrease in 1 pound of weight may equal a 6 pound decrease at the hip when you're walking. So again, if that facilitates then moving more and stepping longer to help the overall process, good stuff.
I also like to use the analogy too, just talking about weight loss in general. Can you imagine putting on a 10-pound backpack on your back and walking around all day long with a 10-pound backpack, and then all of a sudden being able to shed that backpack? How much more energy, how much better you would feel if you didn't have to lug around that extra 10-pound backpack. So that's kind of an analogy I often use with patients as well. And then we'll move right into high blood pressure, which is a condition that affects so many people. And we do know that having high blood pressure is another risk factor for COVID. And I don't know that we're going to talk about too much new here. I mean, I think we've pretty much hounded in how important your weight and your diet does affect high blood pressure. So, but in addition to helping you lose weight, there are things with our diet in particular that are really important for high blood pressure.
Yeah, so with this one we can get a little bit more specific as far as what to eat less of and what to eat more of, because dietary choices significantly impact our blood pressure. So the first step to lowering our blood pressure would be to just take a look at what you're eating on a daily basis. And sodium, cholesterol, and saturated fat can impact our blood pressure the most. So decreasing foods or limiting foods that contain those can really help to control blood pressure a little bit better. They're found in a lot of processed foods, red meats, and processed meats. So working on cutting those out of our diet can really help to improve blood pressure. And just really limiting overall processed foods can really make a huge difference. The next step would be to work on increasing plant-based food intake, fruits, vegetables, whole grains, beans, legumes, nuts and seeds, unsalted. They contain a lot of vitamins, minerals, and fiber, and those nutrients can actually help to lower blood pressure as well. So we want to work on increasing those plant-based foods. And so what you could do is maybe try adding a fruit for breakfast, a vegetable to lunch and dinner every day, and that can influence your blood pressure in a positive way.
What do you think, Kelly, are some of the foods that probably have the highest amount of sodium that you would say, if you could just eliminate it, this, and this from your diet, you could significantly decrease the sodium in your diet?
Yeah, that's a good question. So a lot of canned foods, prepackaged boxed foods tend to have a higher amount of sodium in them. Fortunately, sometimes they do offer a low sodium option, but it doesn't always mean that there's a small amount of sodium in them, so you still want to work on decreasing those types of foods.
In lunch meats, right? I think
Yes,
lunch meats,
yes.
again, you're talking about processed meats. Lunch meats are usually very high in sodium as well. So yeah, thank you. Thank you. Do you have anything to add for the high blood pressure
Once
piece
again,
of it? Exercise,
exercise,
move.
right on. Move and fitness and exercise as a complementary therapy here for prevention and management, of course. And yes, specifically, it improves cardiorespiratory fitness, really impacts all of these comorbidities, which can be associated with more severe cases of COVID. So keep on moving.
And I would just remind people to make sure you are seeing your providers on a regular basis, to make sure you know that your blood pressures can still controlled. You know, if it's been a while since you've had that check, make sure you are taking your medications on a regular basis, so we get that well controlled. Just wanted to throw that in there as well. And the last piece, I've gotten this question a lot from patients who will call up all the time with the concerns about asthma. Obviously, it's very scary to think about being an asthmatic and coming down with a respiratory illness like COVID that can create, obviously, a lot of anxiety, and that's quite understandable. I think it's really important to have your asthma controlled at a baseline, but what does that mean? Like, what does it mean if I say, what does it mean to have controlled, your asthma controlled? There's a rule of thumb that we actually do use to know whether your asthma is well controlled, and bottom line is if you're using your inhaler, or you feel the need to use your inhaler but maybe not necessarily use it, if you're feeling that need to use your inhaler, or using your inhaler more than 2 or 3 times a week, or you ever have to wake up in the middle of the night to use your inhaler, your asthma is not well controlled. You need to see your provider so that we can intervene and get you on a different management routine for your asthma. Making sure that you have an albuterol, your rescue inhaler, available to you at all times, but especially when you're sick. And of course, again, it's all about prevention too. Wearing your mask, washing your hands, maintaining your social distancing, maybe avoiding social outings with friends where masks might be off, even if it's avoiding gatherings with family members, which can be a really tough thing to do at times. I don't know, do either of you two have anything to contribute to the asthma piece?
I think that's great. Again, just back to the breathing, and this is why, again, this could serve as just such a great resource when you get some of these nuances and these questions where if somebody could benefit from progressive muscle relaxation with the breathing and just helping to make more efficient each breath and more optimal when you're dealing with COPD or asthma, boy, those resources are available here through the physical therapy side.
Yeah, and you bring up a good point with the COPD, and I'm just thinking about smoking in general. Obviously, smoking is not good for so many reasons. This is another reason. If you needed another reason to quit smoking, COVID would be another one. I'm always anytime I can get that in there, I'm gonna throw that one in there for sure. It's such an important risk factor for so many reasons. Pretty much, I think we covered a lot of the most common questions and concerns that people do approach us with. Do either of you two have anything to add as we close up here?
Just again, I'll say again, just encourage anyone with questions or just that wants a touch point, just feel free to reach out. We're resources that are here for you, and would glad to come alongside of you as you continue to move better, move more.
Absolutely. Any concerns or questions, we don't want you sitting at home worrying. Reach out. We're here, we can help you, and we want to help you. So please do pick up that phone and give us a call. We want to help.